who is the CEO of JIPA. He will introduce his team and tell you a bit more about JIPA and financing UHC. Okay? All right. So we know that universal health coverage means that everyone receives the health care they need when and where they need it without going through financial hardship. OK? Nous savons, nous voulons tout le monde savent, c'est, là nous parler about UHC, tout le monde ni ouest faire kayo ni pour joindre, là yo vle et côté yo vle, ça we veut à de position côté yo a ped l'argent ou yo quoi fond, ça c'est ba qui très important. So, we have to ensure that whatever we do, we think of accessibility, affordability, and quality. A lot of work had been done before when it comes to UHC. Ça c'est pas premier fois what about UHC or NHI. Mais nous voulons do recently. We've started with services. Nous commençons by public service about UHC. In May 2023, we started with maternal and child health services under UHC. We know that sometimes when mothers are pregnant, it becomes difficult for them to do the ultrasounds and the blood tests that the doctors or the midwives ask them to do under UHC, in general, to see how the children or the baby or themselves, they're doing. So what we've done under UHC is that we've started allowing mothers to get the lab tests and the ultrasounds done at no cost to them without going through financial hardship. Okay, and what happened is that they don't have to pay for it. So you can go to any wellness center and get all the lab tests. Tout ces lab tests là on peut faire test sang ou ça fait wellness center ou pas nous pour payer pour lui. Et si on peut faire ultrasound. So on a pour comment un petit bébé y un boudin on voit où ça aller là pour ça faire. Ça paye pour lui, and that's very important because it could allow us to know if the mother is doing well, if baby is doing well. So si on a un problème avec maman ou petit bébé docteur ou non ça fait pour changer pour faire maman et petit bébé en santé. OK? L'autre bail la moi pour dire nous commencer changer en manière nous faire pap smear. Moun savent pap smear tu faire shy ça c'est un bail qui a fait en wellness center shy l'année passée. It has been there for years. But what we decided to do is to change the method of doing it. So we have a more high-tech method that can actually tell you more about the type of HPV, which is human papillomavirus responsible for cervical cancer. So, nous avons changé manière, nous avons fait pap smear, en disant une technique qui plie mais nous savons qui a été vermine, qui s'abaille madame, c'est madame là, cancer, un coup matrition. Et là nous savons ça, nous savons faire bail pour éviter ces madame là venir plus mauvais, là il pour un cancer. Ça c'est bail qui est très important. Nous pas oublier ces noms là, we did not forget the men. We know that at the end of the day, the men are important as well and the health seeking behavior is different. But anyways, we have relaunched. Nous tenons une clinique avant pour ces noms là, ils sont allés à ce wellness center, but nous savons COVID by taking a team yet, and therefore a lot of people will focus on taking care of COVID-19 cases versus other things. So we had to stop the clinic, but we could have relaunched it under UHC. We started on December 2nd l'année passée. Tous ces noms-là, ils ont créé wellness center, ils ont savent qui joue au café clinique pour nous. Et puis c'est docteur, c'est nurse là qui a examiné noms-là. Ça fait PSCA pour savoir si nous avons des problèmes de prostate. Ça c'est un qui est très important parce que si nous savons ces noms-là, pas douette là, aller, savent côté aller. You have the fear for the finger. So therefore, we asking the men, you can go across, get your PSA done at no cost. If there's a problem, you can get your ultrasound done at no cost to you. And if you need to see a urologist, a doctor qui can specialize pour que nom ou ça pour docteur aussi ça peut pièce là about UHC. Ça c'est un bail qui a fait, c'est nom la cavini. We started on the 2nd of December, and if you look at our data from the 2nd of December to the end of January, we have seen 215 men. Nous avons des cases no. Okay, so that's a good thing, seeing that the men usually don't come, but then now they're coming to the wellness center. OK? Last week, Thursday, semaine passée, jeudi, nous commençons et puis snake bite management. Comment nous can manager si un monde vini et puis on s'est pas pitché. Nous savons une place en ici, hein, Belvedere, and even higher up like Ansteray, Vanna, Jackmel. And also on the East Coast, you might have Poile, Miku, Denry, where we have farmers and persons who would complain about having sticks in the area. And we know we have 4 snakes in St. Lucia, but we only have one that's poisonous. That's the Furdilus. So we know that Furdilus is real. We have them in St. Lucia, especially around the west and east, certain parts of the west and east sides of St. Lucia. And therefore, we have started by educating the farmers, letting them know how to prevent themselves from being bitten by a snake. But more than that as well, if they are bitten by a snake, we want them to go quickly to the nearest hospitals, whether it's St. Jude's or Millennium Heights Medical Complex. And when they get there, they would be able to get the antivenom, the antibiotics, the analgesics, the labs at no cost. If they have to do x-rays or ultrasounds, that is covered as well. Surgeries, if they have to get that done. And of course, the hospitalization cost, because when you get to the hospital, you have to take time in the hospital, sleep, use a bed, breakfast, lunch, and dinner. So we'll cover that while for your admission. And then after discharge, if you have to get outpatient clinic review, as well as physiotherapy, we will cover that as well under UHC. So, nous disons, nous parlons, c'est pas un pitché. Nous parlons, c'est pas un pitché, mais si, c'est pas un pitché. Nous voulons courir vitement, pas perdre pièce temps, vitement aller à St. Jude's ou Millennium Heights Medical Complex, là où là, docteur, nurse là, qui commence à puis med, yo kay ba ou antivenom, ou kay antibiotics, analgesics, ou ça fait test, yo ça fait lab test ba ou test sang. Si on peut faire x-ray, ultrasound, yo ça fait ça aussi, ou pas pour payer pour ça. Tant ou là si on pour faire l'opération, nous kay faire aussi ba ou pas pour payer pour là pour ça ba UHC. Nous kay payer pour temps ou était à l'hôpital là. Parce que nous savons là ou ka coucher là, ou ka rendité, déjeuner, dîner, nous couvre ça aussi. Et puis là au discharge ou aller la caillou, docteur ka do vie ou nous, puis tu voulez ouais comment nous ka faire. Nous ka payer pour clinique ça là ou ka vie ouais docteur nurse là. Et puis si nous avons fait physiothérapie parce qu'on a un problème avec jambes ou la main ou pas body qui a un dommage pour pitcher, nous avons couvert physiothérapie pour mettre en ordre. So tout ces choses dans le couvert par UHC. However, all that being said, we know that you cannot or we cannot do these things without what you call money. We have to be able to finance UHC. Okay, how do we finance UHC? And it's important we go to the different communities, not only going on the media, we have to engage stakeholders. You'll have to know how we finance in UHC, UHC financing policy, and give us feedback, your input. Because at the end of the day, the policy should be ours at St. Lucia. Okay, so Dr. Netka venu parler pour parler about UHC policy, comment nous kay payer pour ces services là, nous voulons bailler about UHC. Parce que nous voulons bailler services comme cancer screening, hypertension, diabetes, nephrology, and eye care, and oral care, and all of this. But we want to ensure that we can pay all of the diseases and all of these things we want to take care of under UHC. Okay? So without much further ado, I'm going to call Dr. Kestened, who is the CEO of JIPA, and he's going to tell us a bit about how we plan to finance UHC. Zot sa veni koute, et puis là il finit parler, vous avez demandé toutes ces questions pour me dire, et puis Dr. Ned, et puis c'est mon qui a souti qui répond nous. Thank you very much. Merci appel.
Good afternoon, everyone. I have a question for the audience. It's a quiz, but I don't want you to look at your cell phone. Do you all, any one of you remember when COVID started? I have one hand over here. Yeah, go ahead. March for St. Lucia. March 2020. That's when you shut down the country. 2019. That's a better answer. 2019. Anybody remember where they were when they announced that COVID was going to be a pandemic and it's going to affect the world? Anybody remember that? All of us should remember where we were, what we were doing, and how COVID impacted us, right? Now, do you also remember when WHO said the pandemic of COVID was over? When was that? That was in March of 2023. So think about this. The end of 2019 to the first part of 2023, we had a pandemic that pretty much shut down the world. You guys remember that? Okay. Now there are a lot of lessons that COVID taught us. Okay, and I'm going to go through that. And the first lesson was sometimes we don't think how important our health is until you, a member of your family, or someone else experience a major illness. COVID was a very unsettling time for all of us. And a lot of us know people who died from COVID, young as well as old. And we learned some very, very important lessons. And one of the first lessons we learned was that our healthcare system was not equipped to handle a situation like COVID. Let me ask a question. COVID is over now. We still get people with it, but we're not dying from it as much as possible. How many of us in the audience think that since COVID, our healthcare system is better to handle another pandemic, or better yet, to handle the situation that we have right now if one of us were to fall down, get sick, and have the need for medical care that's very costly? How much of us believe that we have a system that could do that? Let me see the show of hands. Also the people outside. How much of everybody believes that today, if we fall sick, the healthcare system that we have could take care of us in the way that we should? I don't see any hands going up. Well, guess what? We all need to pay attention to this, because any moment one of us could be affected by a healthcare scare or a healthcare condition where we have to either go to Martinique and we don't have the money to pay for it, or we have to call a relative in America or someplace and say, I need money to take care of my stroke, my heart attack, or any medical problem. And not because you're young that you're going to avoid that. Young people as well as older people could suffer from those conditions. So the reason why we're here today is to talk about how we could make the healthcare system better so that we could afford to pay for the health care we need. And by the way, if you're thinking this is politics, it's not. This is something that involves nation building. Okay? I want you guys to say after me, nation building. Okay, good. So, if you want to have a healthy nation, if you want to have a wealthy nation, there's a saying that goes, the wealth of a country, the wealth of a nation is dependent on the health of its people. All right? The wealth of a nation is dependent on the health of the people. What that means, if tomorrow your boss falls sick and the company that you work for can't continue to exist because your boss doesn't feel around, what happened? You, your family, the mortgage you have, the car you have to pay for, can't be paid for. All right? Does that make sense? So healthcare is an important part of our existence. In fact, we use the word assets. Assets is things that are important to us. Our car, our homes, okay, the school that our children attend. All those are assets we have. And if any one of those assets we lose, the grocery store down the street is an asset. If one day we can't buy grocery, the trucks can't come and deliver the food, okay? Unless you're a farmer and you live and you grow your food next door and you have a few chickens that you could go catch to eat, we all going hungry. So the point is, health care is an asset. It's one of your most important assets. So if we buy insurance on our cars, we buy insurance on our house, right? We should understand that we need to have our health care covered and well taken care of. All right? Does that make any sense? So do we have that taken care of in St. Lucia right now? Okay, I hear a few people say no. We don't have that sufficiently taken care of. Not only are we having that problem, we have tourists that come here. They get sick. They go to the hospital. They go to see a doctor. And a lot of times, they don't even pay for it because we can't bill the insurance company that they have. So end up that we are using our own resources to take care of the people that come. Why shouldn't we have a way, give them a chance to be able to pay for the health care? That's called healthcare financing. Healthcare financing is about how you pay for something. If you have a shop, if you have a store, and you go and buy something that you're going to sell to the public, right? You have to be able to buy the product for a price and sell it for a price a little bit higher than what you bought it for you to make a profit. If you don't make a profit, basically your work is in vain. Now, what's happening in the healthcare system, it's an expense. And in many countries, healthcare represents an opportunity. It's like an industry that employs a lot of people and provide a service where people feel accepted for what, for the care that they need. They're treated in the right way. Now, it's very difficult if you don't have a way to pay for your health care to have a good system. But I'll tell you a secret. There is enough money in St. Lucia to afford a good healthcare system. There is enough money. Just look on the hill and look at the homes that you're looking at here. Right? Aren't they beautiful? Look how much cars we have in the parking lot. Look all around us. Okay? If we could support those material things that we have, why shouldn't we be able to support our health care? Yes. So the reason why we can't support our health care, even though there is money to do it, we are not united. Okay? That's the simple answer. We are not united in the way we organize healthcare and the way we pay for it. On the one hand, you have the people who have insurance. And of course, they're not satisfied with the insurance they have because the insurance doesn't cover and pay for the diseases that people have. Okay, so you get insurance when you're young, but when you're older, you lose your insurance because that's when you get sick. Well, you should be able to have the insurance to pay for the care that you need when you're sick, not only when you're healthy. So if you have a pre-existing condition, like you have high blood pressure, you have diabetes, you had cancer before, insurance company not going to cover you. Why? Because they see you as a risk. Okay? So how do we change that? How do we change that and get people to participate? We have to create a better system where people could feel that they're getting their money's worth for the health care that they're receiving. And that takes, what does that take? It takes all of us participating. So it's not just the government, it's not just the doctors, it's not just the hospital. I know you have a hospital a stone's throw away from you right now. In fact, we were coming down, driving, and we stopped off to take a picture of the piton, and the young lady who was taking care of us asked why we were coming. We told her. And of course, she had a book to tell us about healthcare in Soufriere. So obviously, people take this issue serious in Soufriere, and it's time that we do something about it. So how are we going to fix it? How are we going to fix this? And I know you're asking questions. Now, first of all, does anyone in the audience have any questions they'd like to ask before we go on to talk about how we fix it? Question, anybody? About the healthcare in Soufriere or healthcare in St. Lucia, and how it is now, how you see it, and how would you like to see, what changes you would like to see?
I've been able to get all my medication when I need it. I've never had a problem getting my medication. I had a stroke and I live nearby. Every time I go to the hospital, I get all my medication without a problem. So I don't know what they're talking about when they say there's no medication in St. Lucia.
Okay, so we got one gentleman that's supporting the cause and feel that he's able to get medication at this point. Now, there are others who might say different, but there are reasons why, and I have to tell you, I'm so happy to hear that you have a positive experience with healthcare in Soufriere. Good. All right. Anybody else? Okay, we have a lady over here.
When I go and get mine, I doesn't get all. One must pay behind. Okay. Even the aspirin I doesn't get. So I have to go in the pharmacy to get it.
And you have to pay.
That's right.
Anybody else have any comments on that as far as the medications? Okay, so maybe we could explain why one person is able to get their medication and the other person can't get all their medication. And the reason for that is because we have a system that's a little bit mismatched. It's not coordinated, okay? So in one hand, you have the people that have insurance and the people that don't have insurance. And even the people that don't have insurance sometimes could get their medication and could get health care. And for the people that have insurance, they have to sometimes put their hands in their pocket, pay the doctor first, and then hope to get reimbursed from the insurance company. So it doesn't matter which side of the fence you're on, there is a problem. So obviously some could get and some can't get. What that means is that the system is very complicated. Too much moving parts. And so we got to simplify it. And this is what UHC is about. It's how we simplify the healthcare system from a financing standpoint and a care delivery standpoint to make it work. This is what this is all about. So now we get a chance to tell you how this is going to work. Okay? So for example, if you don't have insurance and you go to the public system to get care, okay, you could get care, but you may not get all the care you need. So what happened? You have to go to the private doctor. When you go to the private system, what you have to do? You have to pay. Okay. Well, we can't blame them because they're in a business. Okay. Now people might say, oh, the doctors charge a lot of money and all of those things, but they have expenses. The hospital that are private have expenses. The public system is funded by the government. So there are resources there to cover. So that's why you're able to get care, because you pay taxes and care comes because of the taxes you pay. Now, how many people in the audience here like to pay taxes? Not too much people. Not a lot of people like to pay taxes. Well, believe it or not, the taxes we all pay is what allows us to get care in the public system. Okay? But the question is, how do we take the money that the insurance company is paying for people and the money that you're paying taxes that go through the government and the money that NIC pay for if you get injured or if you get into a car accident and you get hurt and you have to get care in the hospital, the insurance company is supposed to pay for that, right? So how do we take all that money in one pot, put it in one pot, and redistribute it so that the expense doesn't become yours? And so while this young man over here is able to get all his medication, this young lady over here doesn't get all, and she have to come up with money. But let's have a system that's fair across the board that covers everybody, so everybody feel the same way like this gentleman over here. Okay? So it's important that the system change in a way that makes health care affordable for everyone. UHC stands for Universal Health Care. What does that mean? Universal health care means that everybody in the society universally have access to health care. That's what that means. So we have to change the system so that everybody has access. It means also that for the diseases that people get, that the health system is able to pay for those diseases. So if you have cancer, if you have a stroke, if you get bitten by a snake, any of these conditions, we want a system that's fair. The way insurance generally works, it limits your ability to access certain types of health care because it gets too expensive and the premiums or the money you pay to the insurance company is not sufficient to cover it. So we are in a rock and a hard place. On one hand, you have to have enough money in the insurance to pay, and ultimately, when you need more service, the insurance have to raise your rates or deny you coverage. So the system you have now with the insurance doesn't work as well, and the system of the government needs a boost. So our plan that we recommended to the government is to bring all the parties together. To bring the insurance company, to bring the government, to bring the foreigners that come and get health care that have insurance. But the way you do that in modern times is to use information technology. The first thing we have to do is to learn what's available in our country. You will be surprised to know in certain circumstances, particularly in the primary care area, there are good systems in St. Lucia. But who knows that? Not everybody knows that some parts of the systems really work, especially in the primary care clinics, okay, and in some cases in the hospital. So we now have to first do a better job of explaining how the healthcare system works to the man on the street first, and that's how you make it better. The second way is we have to get the man and the woman on the street conscious about their own healthcare needs. And here's why. If you have a chest pains, or you have a stroke, or you have high blood pressure, okay, and you say, boy, I'm gonna wait till tomorrow to handle that. Okay, how many people do that? They have more important things to do, so they forget that they're having symptoms that they need to take care of. Guess what? You're gonna get a stroke, you're gonna get a heart attack. Your infection is gonna get bad because you didn't go seek care early. And here's the first problem you're making for the health system. You'll make the costs get higher. So because you didn't go take care of that problem early, the cost is higher, and everyone in your circle has to pay for this. Even the people you don't know are paying for you not going and getting health care early. So you have as much responsibility for your health as much as the government, the hospital, the doctor, and everybody else. So it starts with us. And once we know and understand how our bodies work and when problems come, we are able to go seek care. So seeking care early, when you get the first sign of an illness, is critical. Okay? That would lower the cost and save a lot of money, so you could spend the money you save on the most serious problems that other people have. So we got to fix that first. So we're talking about how to fix it, right? Does that make any sense? So in St. Lucia, more than 20% of the cost goes into waste administration that we don't need because the system is too complex. It goes into treating conditions that if we go early, we could save that money for when we really need the health care or the people that need it. So those seems like simple things we could do, but if we achieve those two things, we could save millions and millions of dollars that could go towards improving the healthcare system. So our first goal is to unite the patients, the public, unite the healthcare system, the doctors, the hospitals, having them share information between themselves. So think about it. You come to Soufriere and you see a doctor or someone in the hospital. All right? They give you medication, they get some labs, and you realize they have to send you to another hospital, right? In the north or St. Jude's or one of those. Now, you're supposed to be able to have the information that you could take to the other doctor, take to the other hospital. Guess what? Unless the doctor has the time or the nurse to pick up and call the hospital to tell them what your problem is, when you go there, you have to tell them. And if you don't understand what you have enough, guess what? The doctor over there don't have the information, so they're going to do the same tests that they did here in Soufriere. Guess what? And imagine if you go to a private doctor, a private hospital, now you have to pay for the test you just did. So one of the other ways we're going to fix this is to have computers connect all the different parts of the healthcare system, so that information that you're paying for twice and 2 times and 3 times, that's going to be shared so that all the doctors and all the hospitals will get your information. Of course, we want to make sure your information is private, right? And that it's not shared inappropriately to people that are not supposed to see it. Okay? So that's another way we're going to fix that. Now, obviously, the government is in a better position to put up additional resources. One of the blessings of living in St. Lucia today is that the economy is doing very well. So, of course, there is excess dollars there that now is the time to put that into healthcare. So part of our job is to fight with our legislators, fight with our politicians to say, guys, we want better healthcare. So allocate some more dollars to that system. Part of the challenges in healthcare across the entire Caribbean is that, like the NIC is what you call a statutory body. It runs independent of the government, independent of the hospital, independent of the doctor, right? So we want to create a system in a similar fashion that runs independent of everybody, so that you have professionals running it. Professionals working with the doctors, working with the hospitals to be able to pay for things in an appropriate way. The moment you do that, you get a system that makes it easy. So now, instead of you having to pay the doctor yourself, or the insurance paying the doctor, or the government paying the doctor at the hospital, or a foreigner paying, everything is going to be funneled through the UHC. And once that information is funneled through the UHC, you get efficiency and lower costs. So we're going to have a system called the gatekeeper system. What that means, you get sick, you have a medical person that intervene on your part, that's called care coordination also, that takes you through by the hand to the system, gets you to the right place, the right care. When that care is done, the doctors and the hospital have an ability to go to the UHC, which is the statutory body, send the bills there, and the UHC has the ability to take all that money from everybody, put it in one place, pay the doctor, pay the hospital, but pay it in a way that it meets the cost. One of our major problems in St. Lucia and the rest of the Caribbean, we don't know what things cost in healthcare. We don't know. If we don't know what it costs, how are we going to know how much money to put aside to keep the system going? And so Go ahead. Oh, that's a question that we're going to spend the whole night talking about. He asked, the question he asked, why is healthcare such a problem in so many countries? So healthcare is kind of like food. Think about food. People say there is enough food in the world, but yet you have people starving. How is that possible? Okay? All right, there's enough food in the world. Some people have excess. Some people treat their pets better than how we get treated sometimes. But why is it we have all that food in the world and some people starving? It's about how it's distributed. Okay? It's the same problem with healthcare. All right? We have a problem in how we coordinate the care, how we bring the doctors, the hospitals, everybody in a central way to govern it. So, if you have a system that governs the distribution of food, everybody eats. The truck comes and picks up the food in the right time and deliver it at the right time and the right place so you can distribute it. That's why you have a shop and you have a grocery store. Somebody's thinking about how to keep that shop full with groceries. But if you don't have that, imagine the truck that have to pick up the food from the port. The guy didn't wake up in the morning and he fall asleep. And you don't have rice and you don't have chicken coming. Half the time the food gonna spoil. So the trucker has to show up on time to pick up the food. Okay? Healthcare is the same thing. So when you go to the emergency room and you feel, oh my Lord, I have to wait a long time, or there's a long line, or there is not enough beds and so forth. It's a problem of supply. Okay? Having enough medication on hand. Because if the guy didn't order the medication in the right time, there's a problem. I'm a physician myself, and I practice medicine. And I'll tell you a simple story. I'm from Grenada originally, but I live in the U.S. First place? Oh, yes. Okay. Grenades, yes. We know Grenades very well. Yeah? Okay. So here's the story. And this is a story that happened to my very mother. Okay? And it might sound funny, but my mom, I'm a neurologist, so I treat people like you that had a stroke. That's what I do. I treat people with strokes, with trauma to the brain, and those kinds of things. Yeah, okay. Well, you're doing real good. So here's the story. Someone calls me and told me my mom was having a medical problem. So I told the doctors, look, doctor said, your mom is fine. My cousin was going to Grenada at the time, and she calls me back 2 days later. She's a nurse and said, wow, your mom had a stroke. So of course we got her to the hospital. Now, back then, we used to donate in the US all kinds of equipment and things so we could help, you know, keep the situation so people have access to medical services. So we know we sent them an EKG machine. That's a machine that checks your heart and tells you if you have a heart attack, because a lot of people that have strokes have heart attacks. So I'm on the phone with the doctor and I'm asking him to get an EKG and fax the EKG so we could look and see whether my mom had a heart attack on top of the stroke. Well, I'm there talking and I'm waiting hours, minutes, hours going by, no EKG. So all of a sudden, I hear the EKG technician telling the doctor, oh God, the machine don't have paper. So could you imagine? Something as they have the machine, they have everything, but the machine don't have paper to print the results so I could see. Guess what? Somebody forgot to buy the paper. And this could have a catastrophic event, because have I known what condition she had, I could give her a medication to prevent something from getting worse. So the reason why I told you all this experience is because we have to take healthcare very serious. Very serious. Because, look, American Airlines would not land a plane in this airport if they not show that everything is working right. Right? That's called safety and quality. This is the system we're trying to build in St. Lucia. So we have a system that's safe. Okay? I'm telling you, St. Lucia is way ahead of many of the other Eastern Caribbean countries when it comes to healthcare. And I could say that because we've gone around to most of these countries and worked with them to help build the healthcare system. In fact, we handle many patients that need to go overseas to get care in many of these countries. So we see the conditions. So I applaud your country for taking this important initiative to make healthcare financing a priority. Also, the work that Dr. Eugene and the whole team are doing to ensure that we get quality health care should be applauded, because all of that work is leading up to a better healthcare delivery system in time. Okay? Hope we have a new hospital, St. Jude, that's about to come online. That's major investment and resources for your country. A lot of improvements are taking place in the healthcare system that you might not know about. But it's important that we tie those improvements to financing healthcare. We tie those improvements to education of the public so that you could take good care of yourselves. Now, I'm going to stop, and I'm going to, anybody that will have additional questions about how all the payments would work, we'll be happy to answer it. In fact, let me make a couple of points before I open up for questions. The way we've set up this system is so that we could consolidate all the dollars in one place. Okay? And the way you do that, the government is going to take the first tier, the first layer. Right? And they're going to be responsible, whether you're rich, whether you're poor, everybody is going to get care. Whether you go to the private hospital, the public hospital, for that first layer. Most of that is going to be primary health care. But you're going to have more serious illnesses and conditions taken care of up to $1 amount. Okay? Now, after that, the commercial insurance, the people who have insurance, they could then, we could use the dollars that they have with the insurance to pay for the next layer. One of the things we're hoping to do is to, for especially the people who have employees, we want to have a practice where people purchase health insurance, right? And we are also protecting on both ends, the high cost end and the low cost end, that ability to happen. So that the people that have insurance don't have to put the money in the pocket and pay first. What would happen, UHC is going to make the payment and go to the insurance and say, pay us back. That way, consumers don't have to deal with that problem. And that's mostly for the working class of people that would have insurance. For the people that are retired and don't have insurance, the government will pick up that, the higher cost things for them also. But we feel by including the money from the insurance company in the overall pot, including the money from the NIC, including the money from a car accident, in that big pot, all boats would rise. You guys know about boats rising. If you have a tide that's down, the boat is going to ground. But if we put enough water, all the boats going to rise. The water is the money. If we put enough money from all the sources, it's going to lift all boats. And that's the plan for universal health care in St. Lucia. Okay? I'm going to shut up now and give you guys a chance to ask questions and make comments.
Thank you. So if I do understand you clearly, my very first concern would be, what do we citizens have to contribute to the whole endeavor? By the way, I am very happy that this is becoming a reality in St. Lucia. However, me as a consumer, yes, I am employed and there is insurance available for us. the layman, according to what it is that you've just explained, correct me if I'm wrong, you're saying that the government will actually be pitching in on their behalf.
Yes.
That's for primary health care.
Yes.
Okay. And
And
as we
some
go
secondary
along,
care too, what we call some more advanced things.
Oh,
So
okay.
here's what happened. The government has maybe $150 million that they pay for actual care. Okay? So what we're saying is that $115 million, everybody gets care for that, up to the limit.
I see.
And then your insurance is going to take above that. So not everybody going to seek care. Now, here is, you asked about the contribution. Here is how that's going to work. Currently, if you get sick and you have a major catastrophic condition, okay, here's what happens. 37 cents on every dollar that's spent in healthcare comes from your pocket. 37 cents. We want to change that. So if we're able to spread that 37 cents across the whole country, okay, right, 171, 180,000 people, everybody paying a little bit. Guess what? No one will have to pay 50,000, 100,000, all of that for a complex procedure. Because what we're trying to do is when you have a serious medical illness, we want to make sure that it doesn't make you bankrupt. That you don't have to sell your car, you don't have to sell your house, you don't have to sacrifice your children's future. Okay? That's a very, very important action. All right? So the system takes care of that problem. How many times you know people have a cookout or passing around begging for money to go to Martinique for care? How much of you know that? Everybody in this audience here knows somebody that had to do that. We don't want that to happen again. We have to get it organized so that we distribute the payments across the country. So the government is going to pick up a piece of that. We estimate if we were to take the whole country, it'll cost per month each person about $158 per person per month. All right? That's what it will cost across the country for healthcare in St. Lucia. But what we're doing is we're saying the government is going to take a piece of that $158, the insurance is going to take a piece, NIC is going to take a piece, and what's left, let's suppose it's $20 of that. We're going to take that $20 per person and spread it across the whole country. So maybe all of us, just by buying a sweet drink, which is not the best thing to drink anyhow, just the tax we're paying on the sweet drink, the tax we're paying on the hotel, the tax we're paying on the visitor coming will be enough to pick up that extra 20 cents that the system might need.
we speak, you're saying we've started this process here in St. Lucia.
So as we speak, we are putting the system together. Now, this is something called transformation. We have to when we do that, we have to change laws to make this work. Because the legal system is not set up to allow for this to happen. So we have to write a law, which we're in the process of working with the government on doing, to be able to provide all the protections needed to put a system like that in place. We are taking what we call a stakeholder approach. And the way that works, we are going out to communities like that, like this, and talk to everyone that's going to be affected by this. So we're already talking to the insurance companies because they're going to be affected by this. We're already talking to the banks because they're going to be affected by this. The credit union movement, right? We're talking to the unions. They're also going to be affected because they're doing advocacy for employees. We're talking to the grocery store. We're talking to the companies, the hotel chains. We're talking to the tourist industry. We're talking to all sector of government. So the idea is everyone is affected in a different way. So think about the doctors. If you're a doctor and you have the opportunity to go to Barbados and get paid twice you're getting paid here, why would you stay? So we have to say to the doctors, look, or the nurses, we're losing a lot of nurses from the system. And one of the things we're trying to do is to encourage young people in school to go in the health professions. So we also have to educate young people in the community and let them know and understand about healthcare, because it's a very incredible profession. You're doing a lot of good to help people. So we want to have young people more interested so that we could keep our people at home and provide care for them. A lot of people, a lot of the young folks that go abroad and study, the opportunity for healthcare is so great, they don't want to come back home. Well, let's create an environment so the working conditions could be better. Let's create an environment so that, one, the insurance company wants to come and work with us. So people would want to come and invest in buying the equipment that you need. Someone said we don't have all the equipment we need. Well, the reason why is we don't have a way to pay for healthcare. And the other point is that we can't create what we call centers of excellence. We have to be able to concentrate people, rich, poor, adults, children, in one place so that we could perform the services in an efficient way. And that means reorganization of the entire healthcare system. Great question that you asked. Yeah. Anybody else?
To a heart attack, right?
A lot of people that have strokes have had heart attacks before or after. So remember, the way the body works, it has pipes all the way going through that brings blood. Blood to the brain, blood to the heart, the kidneys. So what happens with people that have strokes, right? The blood vessels that bring the blood to the brain is blocked. So if that's happening in the brain, it's happening in the heart, it's happening in the kidney, it's happening in the legs. So when we see people that have any one of those conditions, we know that they're at risk for having other organs in their body involved. Well, what you may be one of those lucky guys that you may have had, and sometimes if the heart beats in a very unusual way, it could cause you to get a stroke. But the nature has a way of reversing that. There are some chemicals in your blood that literally could dissolve that clot like this. And one of the things we do is that we could give you a drug to help dissolve that clot, and we could literally reverse it. But in your case, that's why you're doing so well. There's a good chance you were able to, your body was able to cure its own self. Some people told you it's because of the vaccine. Let me tell you about that. Because I actually treat patients who have vaccines, and I treat patients who have COVID. COVID is a virus that causes blood clots. Okay? So if you have 1 million people that have COVID, okay? About 5% of those people will have a stroke. If you have 1 million people that have a vaccine, okay, 0.00001% of them could have a stroke. So what that means, you have 1,000 more chances of getting a stroke from COVID than from getting a stroke from the vaccine. Well, good for you. Okay.
The other question,
yeah.
sorry, I don't mean to hang on to the mic, but I'm quite curious. So we are currently on this sensitization drive on its way to implementation. I would imagine that there would be a time frame that you can mention, say, well, then if it is June, December, next year.
Again, you ask a lot of great questions. So we have been moving in this thing quite rapidly, and work previously done got us to this point. We started in October, but honestly, there's a lot of preparatory work that has to be done before we get to this stage. We had to form a marriage between us and the ministry and the UHC team, which has worked very well, and that has allowed us to move things forward. Part of the reasons we're able to move this forward is because our organization have worked with other Caribbean countries to put this together. So we are bringing a wealth of experience and knowledge and systems to push the process forward. So we have created a timeline between now and the first quarter of next year to where we could bring this forth and have people utilize UHC. Now, we're not going to build Rome in one day, so we have to have phases. But we feel that based on where we are, assuming we're able to get the law passed and worked with the insurance company and get all the budgetary things taken care of, and of course, put the computers in place, we should be able to bring this up first quarter of next year. Now, a big part of getting it up is having you all participate, because what you're helping us do is spread the word. We want everybody to be talking about it, everybody to know about this, and contribute to the process. So you are as much a part of us getting it done as we are in putting the process together. Thank you. Any other questions from anybody in the bleachers? You have a question? Oh, okay. Well, we hope that this information was useful to everybody within our hearing. Good question again. Do we have enough doctors in St. Lucia? So we might not. But in today's world, there are ways that we could extend the access to doctors by them not even being here. There's something called telemedicine that we doctors do, where we're able to see a patient over a video camera, and we could review the records, we could look at the x-ray, and we could make diagnosis. So even though you don't have all the specialists in one place, we're able to work with other doctors locally to be able to do that. And so, except for when you need certain types of surgery, all right, and also there is an overseas care component to this, where if the services can't be offered in St. Lucia, we have the ability to organize for you to go elsewhere to get that care provided. Yeah.
Earlier on,
Dr.
Eugene was speaking. She made reference to the snake bite management parts. You did make mention of OKU and St. Jude's. Soufriere was not mentioned. Does that mean it's not ready, or Soufriere, the services are not already readily available in Soufriere?
Okay, so yeah, when we looked at or started discussing about snake bite management, it made more sense for us to place it in additional sites like Soufriere and Stakeholder, as well as Dennery. Yeah, but we have to make sure these facilities are at a certain level, because when you give the antivenom, you have to monitor lab tests and certain things we have to do. So if we don't have that capacity to do this yet, we cannot go ahead and then give it and then just let the person go off like this. Yeah, and you have to ensure that you have ambulances, a team ready to move the patient from one point to the next, and another team to come and replace them at the wellness center or at the hospital to ensure that you continue care for other persons coming in. So it's not something that's out of the discussion box, but we have to make sure that we can bring you all to that level so we can give the medication, give the whole regime, and safely allow monitoring without putting the patient at risk. Yeah, but yes, it's something that is being discussed. Yeah.
I'd just like to know how much time you have.
we asking patients to go as fast as possible. Because even though we tell you all you'll have within 4 hours, we don't want you to go home to wash your clothes, go play hard, nettoyer Kyla, play a grip, you know, do all the different, because you know us already. If we have to go to the hospital, let me go and fold clothes, let me go and cook food, let me do all of this before. We want you to go as quickly as possible. Because if you start giving time frame, you know, we're going to start watching our watches, and then before you know it, the time we want you to go might go long. And you don't know what's going to happen because people are different. So we want you to go as soon as possible. And the outcome, the clinical outcome is better the faster the antivenom is administered. So we don't want you to waste any time. Yeah? Uh-huh. But Soufriere to cash is not 4 hours, eh? Yeah, so go as fast as possible. Yeah, I know. Yeah, all of that discussion started about what you can do here and shift. But we have to be very careful when we give the antivenom, and we make sure that we have the staffing and everything, the lab tests and all the other things. And you must understand that Soufriere doesn't have all of this as yet. So that discussion is not out of the box. It's already started to look at areas where we can possibly, but we have to monitor and we have to make sure that we're in agreement to do it as a ministry. Yeah, we just can't say. But it has popped up, that discussion. It's not something that's far-fetched, but at the same time, we have to make sure that everything is readily available, the monitoring, the human resource, and everything. Because we do not want an adverse reaction of any way or any anaphylactic shock or something that will cause the patient to be disadvantaged or something happens because we administered something that we cannot monitor and move forward with. Yeah? Thank you.
Well, I understand. Now, I hate to give medical advice without having more details. More details. Yeah, well, that's not the best advice. I wouldn't advise you to do that. Because, of course, the fact that you had a stroke, you have risk factors. And quality of life is important. So, the other question I would ask you was, when was the last time you saw a doctor? Okay? And when you see your doctor, what does the doctor tell you about your health? Okay? Well, okay, good. So then they're going to check you. Well, good. Well, it seems like you're hanging in there. You just got to improve some of the dietary situation. You're going to be even better. Well, that's true. That's true. Yeah. Okay. We all do, right? Okay. Anybody else? I see some of the people on the outside. Anybody wants to ask a question? Any questions? So maybe we could ask you all some questions. Okay? What, in your opinion, right, would make Soufriere a better place for healthcare? What do you think could be done to improve the health situation here in Soufriere? That's a wide open question. A better hospital? facility and staffing. Yeah. Operate, yeah. Yeah. Yeah.
Check.
So I'm gonna vote for you. You hired. Yeah, go ahead.
Okay, so hopefully in the next, not weeks, but I would say in the next upcoming months, you will probably know more about it from relevant sources to know that some of the questions and the concerns you bring up here will be considered. Yeah?
I must say, can you please utilize this as well as at the foundation? Because one of the things that we are looking at in our department as well as an organization is that we're organizing a list of health beds throughout the year. So this one was just the first one because we're honoring our independence. However, there are few of them that we would like to zoom in on particular medical areas. And so, of course, we would like that information to be able to sensitize the public who is actually here today. And so that we could use that as a little bit.
Great point. Yeah. Well, again, we yes. Yeah. Yeah. One pharmacist for the whole region. Yeah. That's important that we change that. Yeah. Well, it's a work in progress. Let's say this. Every year we got to make a bigger step. When we get to the helipod and the heliport, we're making progress. But those are great ideas for the better in the healthcare system. Yeah. Yeah. Okay. Anybody else wants to give an answer to my question as to what else they would like to see other than a better hospital, one more, an additional pharmacy, and technicians? Yeah. Now, like I said, all boats rise. Once you provide the funding for this with good planning, good communication with the community, this could change. I mean, St. Lucia has done amazing in other areas. if we done what we have here in tourism and it works, why can't we do it in healthcare? You know, the fact that we made progress in one area, it tells me that we have talent on the ground that we could utilize in the public and private sector to make something as grand as this happen. Yeah.
Time you're young, I have to start all over. So, more comprehensive, effective, all year round preventative healthcare programs and projects that would cause persons to change their lifestyle, to live a more healthy lifestyle, so that we can deal with this diabetes and hypertension and so on that we are plagued with presently.
Well, I don't know if you were here earlier, Dr. Eugene talked about some initiatives that are ongoing now under UHC. I don't know, Doc, you might want to say a little comment on that. Oh, okay. Yeah, but that's a great point that you make. And I really think that forums like this give people an opportunity to really take internal look at themselves and say, where am I heading with my life? Yeah.
Ministry of Health is working with Ministry of Education to have what you call the school health desk. So in that way, I mean, some time ago, many years ago, we used to have a nurse coming to the school and everything. That's years ago. So we're trying to have that kind of relationship again so we can deal with the children in the school and bring healthcare back into the school. That relationship between Ministry of Health and Ministry of Education. So that would allow us, Ministry of Education, to deliver all the prevention and the treatment and all the necessary things that the children need from earlier clock to curb it before they become adults with problems. So that is one of the things we are actually working on. Okay?
You know, there's another thing we should check. You know, the snakes are closing in. Where you never used to find snakes, you find them now around Soufriere. So I think they should hurry to get the anti-venom to the Soufriere hospital because the snakes are close by. You know, about 5 years ago they were much further away. Now they, in these hills, in Zano, you find Fedinas, you find boa constrictors. They're closing in. So I think they should hurry and get some anti-venom to the Soufriere hospital.
Okay, message delivered. Okay. Okay, anybody else? Well, Doc, I'm going to turn this back over to you. Anybody else has burning questions that they want to ask?
Okay. The Soufriere people are very quiet. We went to other areas and the questions were heated and they had a lot of discussion. I think maybe the Soufriere people are very quiet. No queries, no concerns, suggestions. I mean, we got some good feedback and ladies, we thank you. We thank you, sir. But anyone else? Any question on UHC financing? Okay. Well, we want to thank you very much for taking your time out of your busy schedule to actually come here and listen to what we have to say. The journey has started and will continue because UHC is something that is broad and we want to ensure that everyone in every corner, as we say in St. Lucia, know about UHC, okay? So that's very important. So I want to thank you. We have refreshments in the